It's like a love-in, you know, coming to Massage Mary. It's like having a very special date, and it is the most special date that I have of the week. And I know it's like that for everybody that massages Mary, her friends, family, volunteers. And she's so receptive, you know. Just because she's paralyzed doesn't mean she's receptive. You know, Mary has a personality of being a teacher. And there's that curiosity, and there's that always learning type of personality, and always teaching. And she has a way of teaching us that's non-judgmental, you know, and it's just wonderful being in her presence. And it's been wonderful doing this project with Mary, so that we can teach everybody how to handle these hands-on situations that look a little intimidating and a little beyond the normal massaging that we might be doing every day. So it's amazing that these hands, in their paralysis, have been able to do so much for people.
What do you think is important about teaching the family and loved ones, close friends, about massaging Mary? How do you think that benefits the family members and the close friends and Mary?
I think that massaging Mary benefits friends and family in a number of ways. The most important is that they don't feel helpless. And Mary's given people an opportunity to feel useful, and that really takes care of a lot of the pain. It helps soothe the pain of loss and anticipation of missing Mary. And I really know from past experience that the more you can touch somebody, they stay at the ends of your fingertips when they're not here. And I know that when Mary's not here, I'll still be able to feel her. I'll still be able to feel what it was like to touch her. And it's like locking that in. Is that a comfortable rest? It's like you're massaging me. Feel your hands moving right on my elbow. Now you're massaging down my forearm. It's a very good massage, Mary. Thank you.
So that's where we are. Then we did a little bit around the shoulders, we did biceps, triceps, and now we're just doing forearm and hands.
Is Lorraine a good teacher, Mary?
What's she gonna do? Say no?
Yes. She's always honest. She didn't ask for the fingerboard.
Right.
I like that fingerboard. That's a great idea.
Yeah, well, it kind of mimics the computer idea that she has
Yeah.
downstairs, but it's manual like we do it right instead.
That's good.
Probably a little bit faster than her computer too. So now we can do again the corkscrewing on the same as we did with the toes. So securing the.
And you could pick up her arms so that you don't lean over.
Oh, okay. And leave her elbows on the bed.
Yeah.
Okay.
Now, so you're holding.
I'm securing the joint.
Okay. And
So
you're
with this
starting
hand,
with the tongue?
yeah,
Okay.
and we're corkscrewing in towards her.
In towards.
Yep, just like the way we did with the big
Oh,
toe.
In towards. Okay.
Yeah, exactly.
And then I find it easier standing. You can
see that.
vary it because we're different heights. Really? And then you can bend the wrists and into the back of the hand like this. And then you can corkscrew each finger. Nice work. Now the trick is to bend Mary's hand high enough that you don't have to lean over.
Oh, okay.
So, and your back will be better preserved if you're, yeah. And I always use this front leg just to go forward. Yeah, that's it. And if you lean against the chair, right away your back won't give out. And then we can go down each finger. And Mary remembers if you miss a finger.
Yeah.
And then maybe onto the next finger here, and so we'll
With the joint and
secure the joint and right, corkscrew in towards Mary.
Do you want me to suction, Mary? Okay.
And then the middle finger. Okay.
And is that inward as well?
Well, that's the way I do it, seeing as
Yeah.
how I'm already positioned here, but it can go either way because that is the midline.
Mm-hmm.
So just because I've got my hand there.
I can feel slight little tiny cracks every once in a while when I'm doing
In her fingers?
That's good right at the base here. Because Mary's hands are in one position all the time. Except, you know, when she's transferred and that kind of thing. But it's really nice to get all of this scrubbed. And Lila takes really good care of Mary's hands. So for someone in this position so much, Mary's hands are probably in the best shape of anyone I've ever seen who's got. So I want you to emphasize where the fingers attach, right, at that end. Yeah. But the other end, even though there's some muscle wasting here in the palm, pretend it's not wasted because it feels good right here, eh, Mary? And that's, Mary's hand is resting often in these positions, but just like it felt good when she was pre-ALS, it feels really, really good when her hands are compromised like this. So you can really spend a lot of time at the heel of the hand. There you go, Nick.
Thanks. No matter what the position. And then we can probably just finish up with the light stroke from the shoulder down to the fingertips.
Great teaching, Lorraine.
Okay. Well, you're the master, Christine.
It's nice to see somebody else. Good, that's wonderful.
I'll just pass along what you've told me 1,000 times, that's all. So I will put the pillow back for your hands here, Mir. This side seems, yeah, this side would be way too rough.
Okay.
And then your sheepskin's fine.
Mary's massage people have done different movements, and Melissa does lots of arm movements. And then this one where Mary's elbows are straight. And usually when you put your arm above your head, you kind of rotate it as it's going over. So, how are we doing? And I think you can stretch out the elbow. Nope. Is that enough? Okay. And then stretch it right out. And then we'll go up again. Is it easier, Mary, when we're more towards the inside or the outside? Inside? No? Right about there? Okay. Okay, say when.
When?
Is that enough? And then I go back and do some, thank you, to that joint.